In our practice, the vast majority of our rhinoplasty patients will be asked to tape their nose postoperatively for at least several weeks. Many of my patients will need to tape for the full 12 months. The purpose of taping the nose is to help the skin shrink wrap down over the new cartilage and bone framework underneath. Think of it like someone who's been going to the gym and now has amazing definition of their abs. If they wear a bulky sweater, you would never know. The goal of taping is to allow us to show off that six-pack underneath. There are two types of patients for whom I think taping is really important. One, thick-skinned patients, and two, patients for whom we've made a significant reduction in the size of the nose, the cartilage and the bone. So again, the idea of taping is to help squeeze out any swelling and really encourage the skin to redrape and shrink wrap down over the cartilage and bone underneath. By closing off that space in between the framework of the nose and the overlying skin, we prevent any excess scar tissue from developing in that space. And then finally, we can use the taping to help support the tip in a lifted position while it's healing too. Now, everyone is different. We will assess the need for continuing the taping at each of our follow-up appointments. At a minimum, I would have patients tape each day for 6 to 8 weeks, and in some cases for as long as 12 months. Now, the longer you tape, the better. At a minimum, I ask that you tape before you go to bed at night and take it off in the morning. If you can leave it on during the day too, all the better. Taping is definitely most important in the early stages of healing, in those first few months. But in many thick-skinned noses, we see benefit from taping even well beyond that 6-month mark. Now, we like the 3M micropore tape. You can buy this on Amazon, or you can get it from us. It's the perfect width. It allows you to compress the skin down tightly, and it's fairly inconspicuous given that color. So you want to be set up in front of a mirror. So I've got a trusty mirror right here, and have your supplies ready. So the 3M tape, micropore tape, and then some scissors. Now, we're going to start at the top of the nose and work our way down. So we want to cut the first piece, 2 or 3 centimeters long. I like to cut them in the shape of a trapezoid. I think it makes it sit on the nose, along the edges of the nose a little bit nicer. I also like the shape because I like math. We take that piece with 2 hands. You want to apply that. I'll just lift up my glasses for this part. I'm looking in the mirror. You want to apply that at the top of the nose, right at the root of the nose, evenly with equal pressure, and kind of squeeze it and snug it down. Once you've done that, then we're going to work our way down. So now we're going to cut the next piece. And this one we're going to cut a little bit longer. Again, in the shape of a trapezoid. So this one, maybe we'll cut it maybe 3 centimeters long, and I'll just make a couple and leave them on the edge of the table here. Again, you want to be doing this in front of a mirror so you can see what you're doing, and to make sure that you're applying those pieces nice and evenly. If you're distorting the nose when you apply a piece, when you look in the mirror, then take that off and apply it again. So the next piece, again, we take both edges, again, the shape of a trapezoid. And this time we want to overlap the previous piece by about 50%. So again, looking in the mirror, you kind of overlap that, even pressure, squeeze it down, and then smooth it out on the edges. And again, I want to stress, you really want to apply a little bit of compression when you're doing this. We're really trying to shrink wrap that skin down over the cartilage and bone underneath. So we do our next piece again, we're overlapping by about 50%, squeezing that down. And then we keep going successively longer and longer with these pieces. So this one's probably somewhere around 5 centimeters long, but obviously you're going to make it the right length based on the size of your nose. Where we want to end is in this area here called the super tip. So the area right above the tip. Often that's where patients have a little dip in their profile or a transition to give more of a lifted look to the tip. And so in patients who we really wanted a nice super tip break, we want to make sure that this piece is especially snug because this is a common area for scar tissue to build up, especially in thick-skinned patients. So we want to be extra tight with our taping here, again, without distorting the nose. So this one, again, if you have a look, and we're staying above, this is the tip area, so we're staying above that. We want to make sure we're not pushing the tip downwards. And then again, I'm going pretty snug and applying that down tight. Our next piece now is going to be the one that goes along the bottom to support the area under the tip. Now, I should stress, just going back for a second, for patients where we don't want much of a super tip break, for example, in male patients, I don't want you to lay that one down too snug, just regular kind of compression. And when you're coming along the bottom, this piece is going to go underneath the base of the nose here, underneath the tip. But we want to make sure that you're not covering the nostrils because you still want to be able to breathe. So again, always even pressure, both hands. You can look in the mirror, come at the bottom part here, and then slide it up the sides of the nose. Apply even pressure, snug it down, and then when you get to the bottom, you can give it a little crimp. Once you've gone to this point, you should do a second layer by repeating all of those steps, but in reverse order, starting with the piece around the bottom of the tip and then working back up to the top. I won't do that on camera, but again, it's the exact same steps. And then remember, for this bottom piece, you are pulling it up a little bit to provide a little bit of support as you're lifting that tip. Now the question is, well, how do we remove the tape? And removing the tape, you want to be doing it very carefully. It's just as important as how you apply it. You want to make sure you don't lift it off too aggressively or unevenly and cause any trauma to the skin or worsen the swelling by lifting it off too aggressively. You have two options for removal. Either use the adhesive remover or get in a warm shower, not too hot, but because that can make swelling a little bit worse, but a warm shower and really soak the tape. Then you can use tweezers. I have, medical grade forceps, but you can just use regular tweezers and a Q-tip to help gently, carefully, evenly, looking in the mirror while it's wet, peeling it off the nose. You want to do that while minimizing stretching of the skin. So again, do this in front of the mirror. If you're using an adhesive remover, and you can get this from our office as well, we've got a bunch of this stuff called Solvoplast. Essentially, you want to take this, pour it into a little Dixie cup or a little cup of your choosing. Well, we don't need a ton. And then you want to have a Q-tip that you can use to really soak the tape. So looking in the mirror, you're going to get the tape nice and wet. It's got a nice chemically smell to it. And in doing that, you kind of soften the tapes and get them to start lifting off the edge a bit. And I would kind of just get everything wet all the way up the bridge. Try to keep this off my glasses. Now, once it's looking pretty wet, fluting along the tip here, or the infra tip, then you want to grab some tweezers and start lifting the edge. And then get underneath that tape edge and kind of roll the Q-tip. Continue to get it wet with the adhesive remover, and then really just try to lift that off by both rolling and peeling. And once you've done a bunch on one side, then come to the other side. So again, you're removing it evenly. And peel that off gently while you get all that tape wet. And here I really want you to take your time. There's no rush with this. I want to make sure that it's coming off without causing any trauma to the nose. Good. So some of that has come off. And then continue all the way up, peeling that off. And that's now coming off very easily because I got it nice and lubricated. So remember, take your time, get the tapes nice and lubricated, either in the shower or with the adhesive remover, and really let that tape come off with not too much tension. You're not pulling on the skin, stretching it, lifting it up, twisting the nose. You want it to be nice and gentle. Okay guys, so that's basically it. Again, I can't stress enough how important taping is for so many of our patients. So do your best to stick to it. Be religious about it every night, all day if you can on certain days. And then remember, when you're removing the tape, to be really gentle and careful as you're removing it. If you have any questions, feel free to reach out anytime. If you need any more tape or any adhesive remover, we're happy to mail it out to you. Just let us know. And wishing you a super speedy recovery.